Hello and welcome to today's video. I partnered up with my fellow university student Annelie to have a look at a recent study from the DAK and IFT Nord on teacher health during the COVID-19 pandemic in North Rhine-Westphalia in Germany. The measures to control the pandemic led to drastic changes in everyone's everyday life, both private and professional, within a very short period. While part of the working population was confronted with short-time work, the workload of some professional groups increased significantly with the onset of the crisis. In addition to medical staff, who have a special role during this crisis, teaching staff at schools were also particularly affected by the school closures and had to cope with many challenges at short notice, such as the switch to digital teaching. At the beginning of the 2019-2020 school year, face-to-face teaching was resumed in schools with the implementation of and compliance with various measures to contain COVID-19. In addition to teaching, they must pay special attention that the kids keep their distance and correctly wear masks, sometimes acquire new digital skills, find ways of communicating with parents' homes, and adapt quickly to changing learning situations, which has significantly affected their daily work within a short period of time. In addition to the changes in habitual structures, many teachers belong to the corona risk group due to their age and find themselves facing dangers that can lead to the formation of fears and worries in the individual. The workload of teachers was already high before the crisis, but during the pandemic, the stress increased even more. However, the health of teachers plays a crucial role, as it has a decisive impact on the quality of teaching and thus on the learning success of the students. The question is whether and to what extent the corona pandemic has an influence on the symptoms, and whether and to what extent the corona-related changes in everyday school life influence the job satisfaction of the teaching staff, is still unanswered. The aim of the study was to obtain a perception of teachers' daily school life during the pandemic. The focus is on the stress of teaching staff, such as emotional exhaustion, as a leading symptom of burnout, as well as the question of whether everyday school life influences job satisfaction under the corona conditions. The final sample included 2,300 teachers from different types of schools, from primary to vocational schools. The corona pandemic led to extra work for 84% of respondents, reflected in an average of about 6 hours of overtime per week. About 7% went to school with anxiety, 1/6 were afraid of getting infected by students, which were 15.7%, and 1 in 3 were worried about their students' learning progress, 31.6%. About 59% rated teaching as far more stressful than the year before, with the main reason being getting students to implement the COVID protection measures, 22.5%. For school administrators, on the other hand, the main reason for the increased stress was the workload caused by absences of colleagues, 23.5%. Almost half of the respondents, 46.7%, did not show any symptoms of emotional exhaustion, whereas about 28% did. Regarding the type of school, gender, and age, teachers had a higher risk of emotional exhaustion than headmasters. In contrast, according to the majority of teaching staff, the corona situation in schools did not have a particular impact on the satisfaction with their jobs. More than 80% of the teachers surveyed stated that they were satisfied with their teaching profession. The results of the present study show that everyday school life in the corona pandemic is stressful for teachers. This can be seen in their concerns about their own well-being as well as that of their students. 1 in 4 teachers showed symptoms that could indicate burnout. The corona situation seemed to increase symptoms in those with high levels of fatigue. The special analysis of the prevention radar Teacher Health 2020 was designed as a cross-sectional study. A one-time survey of teachers from different types of schools in North Rhine-Westphalia, Germany, took place in October 2020 using a standardized online questionnaire. All schools in North Rhine-Westphalia were informed about the study by email on 5th of October 2020 and asked to forward the link to participate in the survey to the entire teaching staff. This applies to about 72% of the schools after recruitment was completed. This means that 1,581 schools were reached. Principals and teachers were able to participate in the survey by clicking on the link. It was and is not possible to trace individuals. First and last names of the teachers, as well as the school's name, were not recorded. Personal details such as age, gender, and membership of the corona risk group were voluntary. The questionnaire was programmed using the Lime survey software. It was divided into different sections and contained closed items on general characteristics such as type of school and position at the school, as well as on the number of teachers. In addition, the teaching staff was asked to assess their daily school life under corona conditions and their cooperation with colleagues. Personal stresses, such as worries about their own health and the effects on the stress of pupils, were also recorded. To obtain information about the teacher's stress, emotional exhaustion was measured as a central construct. Emotional exhaustion represents the leading symptom and the central quality of the burnout construct, which is based on 3 symptoms: emotional exhaustion, depersonalization, and reduced performance. Emotional exhaustion describes the feeling of being exhausted and having used up one's emotional resources. Teachers were asked 9 questions about the frequency of emotional exhaustion. In addition, the job satisfaction of the teaching staff was surveyed, and for the constructs of emotional exhaustion and job satisfaction, it was additionally recorded whether the everyday school life under the corona situation causes a change in the occurrence of exhaustion symptoms or influences job satisfaction. Age, gender, and being part of the corona risk group was voluntary data the contestants could give. The survey gave the opportunity to make comments through open response fields. Only fully completed questionnaires were considered in the analysis. Partially completed datasets were excluded. The questionnaire was fully completed if all compulsory questions were answered. To interpret and classify the results of the teacher's stress, the item of the emotional exhaustion scale was summed up. Higher values indicate a higher degree of burnout. For teachers, the following values apply: low values below 16, medium values 17 to 26, and higher values over 27. Teaching staff with a scale value of 27 or higher therefore show symptoms of emotional exhaustion that may indicate burnout. Let's have a look at the results of the study. The sample consisted of 2,747 respondents, of whom 2,300 completed the questionnaire, which can be seen on the left-hand side. On the right-hand side, the percentages can be seen. Of the 2,300 respondents, 2,280 specified their risk group, 2,270 specified their age, and 2,265 specified their gender. 1 in 7 respondents, 14.4%, stated that they were head teachers. 1 in 6, 17.8%, were teachers with additional coordinating responsibilities, so-called coordinators, and around 3% were teachers in training, trainee teachers. The majority, 63.1%, were teachers without special functions, were female, 77.6%, and between 30 and 50 years old, 58.5%, taught at primary school, 34.2%, with about 20 to 50 colleagues, 31%. About 19% belonged to the corona risk group, whereas 37% of those over 60 did not consider themselves to belong to the risk group. Teachers were asked whether they felt that they had to work more since the beginning of the school year due to the pandemic. Do you feel that the daily school routine under corona conditions leads to extra work in your job? Most respondents agreed with this statement, 84%. Rather yes, 42.4%, clearly 41.6%. About 1% of the respondents reported no extra work at all. About 15% said they tended not to work more than usual because of the corona situation. Differentiated according to the function held by respondents, it was found that about 73% of all school headmasters worked significantly more than usual, followed by coordinators, 46.2%. On average, respondents reported working 5.9 hours of overtime per week due to the demands of the corona crisis. School headmasters reported an average on about 9 hours of corona-related extra work overtime per week due to the requirements to contain COVID-19. Now to contextual factors. Most participants saw the school as well prepared for changing learning situations. 53.7%. Head teachers agreed with this statement most often. 72.9%. Every second teacher was convinced of this. 49.7%. The majority agreed with their colleagues on how to proceed in the corona situation. Fully agree 26.5%, rather agree 49.8%. During the school closures, most colleagues were in contact with each other. About a quarter said they were not, and for about 7%, this statement did not apply at all. For most, the school day does not offer enough time for recreation. Only 1 in 10 agreed with this statement, 9.4% in total. About 90% of the respondents believe teaching has become significantly more exhausting compared to the previous year. The main reason for the increased effort was seen by most respondents as telling the students to implement the corona protection measures, 22.5%, followed by self-protection, 16.4%, stress due to colleagues' absences, 14.6%, and other reasons, 15.4%, where the majority said they saw all the listed reasons for the increased effort. In addition to the perceptions of everyday school life, school staff were asked about the personal fears and concerns. About 1/3 said they were afraid to go to school because of the situation. Strongly agree 7.4%, somewhat agree 26.2%. For a large part of the respondents, this statement was rather not true, 40.6%, for a quarter not true at all, 25.8%. The fear of catching the coronavirus from the students was more widespread than the general fear of going to school. 51.4% agreed with this statement, strongly agree 15.7%, somewhat agree 35.8%. Worrying more about one's health since the corona crisis were reported by about 65%. In addition, the fear of not knowing what will happen in the coming months was observed. Around 84% of respondents are burdened by uncertainty. Therefore, teachers are more afraid to go to school than headmasters. In addition to concerns about themselves, teachers were also asked to assess the situation for the students. 3/4 of the teachers, 77.8%, were concerned about the progress of their students, school headmasters 78.9%, and other teaching staff 77.6% to the same extent. Teachers at gymnasiums, 77.3%, were less concerned about the learning progress of the students compared to the teachers at other secondary schools, 82.3%. About 80% agreed that the corona situation is a great burden for students. 2/3 reported that students implement the corona measures and rules well, 69.2%. Primary school students, 87.8%, ahead of secondary school students, 79.6%, Förderschule, 73.5%, other secondary schools except gymnasium, 44.6%. The much smaller proportion of vocational school teachers agreed with this statement, 42.4%. Almost half of the respondents, 46.7%, showed no symptoms of emotional exhaustion, such as feeling drained or burnt out. About 25% fell into the middle category, and for 28%, a scale value of 27 or higher was calculated, indicating a distinct emotional exhaustion. On average, about 4% never felt emotionally exhausted, about 30% a few times a year, and about 29% once a month. About 1 in 6, 17.7%, experienced feeling emotionally exhausted a few times a month. About 1 in 9, 11% once a week, about 6% a few times a week, and 1.5% daily. Teachers had a higher risk of feeling emotionally exhausted than headmasters considering type of school, gender, and age. A further examination to identify risk groups shows that especially teachers without a special function, as well as teachers in the preparation service, have a higher risk of exhaustion. The corona situation in school affects the frequency of occurrence of emotional exhaustion according to the assessment of teaching staff. Teachers with high levels of emotional exhaustion were more likely to report that the corona situation increased their symptoms, 77.8%. About 42% were not emotionally exhausted. Averaged across the response categories, about 25% of those who had never been emotionally exhausted felt affected by the corona situation. In the group of those who experienced emotional exhaustion a few times a week or daily, this was about 86 and 83% respectively. However, the general level of job satisfaction is high. Most of the teaching staff surveyed stated that they were satisfied with their job. For about 44%, this was completely true. About 40% agreed somewhat, 12% was somewhat dissatisfied, and only 2% expressed dissatisfaction. School headmasters were more satisfied with their job than other teaching staff. Respondents were asked to assess whether, and if so, in what direction, job satisfaction had been changed by the corona situation. About 87% felt that their job satisfaction had not been affected by the corona situation. About 12% reported that they had become more dissatisfied, and only about 0.3% said that the situation had increased their satisfaction. The findings appear to be independent of the function of the teachers. High emotional exhaustion is associated with lower job satisfaction. 96% of respondents with low levels of emotional exhaustion were satisfied with the teaching profession, compared to 87% of those with medium levels of exhaustion and about 64% of those with high levels of exhaustion. Even after taking type of school, function, age, and gender into consideration, this correlation remained the same. In a further analysis, it has been investigated which individuals were most affected by the corona situation. Female teachers, headmasters, and respondents with health concerns, as well as those with high levels of emotional exhaustion, were most significantly affected by the corona situation. No correlation was found for age or type of school. Communication within the school was shown to be a preventive factor. Teachers who felt well and sufficiently informed about innovations and decisions by their school management were less affected by the corona situation. And fears for their own health, high emotional exhaustion, and female gender were identified as risk factors. Beyond the closed questions, respondents had the opportunity to provide feedback. They were asked to complete the following statement. In one word, to describe being a teacher in the times of corona is... You are again very welcome to practice your German. More than half of the responses, 57%, included words with negative connotations, for example, burden. About 3% completed the statement with words with positive connotations, for example, fulfilling. And about 40% of the responses were neutral, for example, interesting. In addition, the respondents had the opportunity to make further comments. Almost 30%, 656 respondents, answered the question, "Is there anything else you would like to tell us?" The answers can be assigned to the following categories: causes of stress, emotions, concerns, specific wishes, positive comments, and other comments. More than half of the answers, 581 responses, refer to causes of stress. These include lack of support, general weaknesses of the education and school system, which have become increasingly important in the time of the corona pandemic, for example, large class sizes, lack of staff, lack of digitalization, lack of public appreciation and recognition of the teaching profession, constant adaptation and availability combined with planning insecurity, lack of staff, increase in responsibility and pressure to meet expectations, subjective pressure on the teacher, lack of knowledge, lack of motivation, and lack of a sense of responsibility. The pressure of expectations, subjective perception of doing worse lessons, increase in administrative work, lack of breaks, private challenges caused by the corona pandemic, for example, caring for relatives, double the strain as a parent in homeschooling, difficulty in implementing the corona-related measures, lack of contact with the teaching staff, conflicts with pupils because of the measures, lack of compensation in free time, and anxiety of colleagues. About 1 in 5 comments related to emotions, such as fear of infecting oneself or others, feeling left alone, frustration, exhaustion, stress, tension, anger, helplessness, and sadness. Just under 1 in 6 shared concerns about being infected with the coronavirus, their own mental or physical health as a result of the corona-related changes and measures, for example, vocal strain from wearing masks, vulnerability to infections due to the draughty and cold workplace because of the ventilation, or emotional overload, The pupils, for example, due to the social restrictions, the learning progress of the pupils, their own training situation in the context of the traineeship, and the lack of school development. Wishes expressed included clear and uniform guidelines from the ministry, the provision of materials, for example protective materials and technical equipment, higher occupational safety, further training, for example on distance learning or digital learning, relief and breaks, more staff, significant practical relevance in the measures, faster provision of information, digitalization, offers of help, and remuneration for overtime for trainee teachers. Positive comments of the teaching staff referred to opportunities and advantages resulting from the crisis, for example, learning growth on the topic of digitalization, gratitude for job-related financial security during the crisis, continued joy in teaching or working with children, cohesion in the school community, or feeling of solidarity and usefulness. After all that input, feel free to check out the survey we have analyzed for you and stay safe. Thanks for watching.